All right, Miss Anderson, I'm going to be right with you. All right, I'm just going to wash my hands. All right. All right. How you doing today? Very good. Thanks for asking. So my name is Prentice Strawder. I'm a student physical therapist, and I'm going to be working with you today. Is that all right? Okay. So I've seen that you progressed very well with the manual limb drainage. Okay. So today I want to try something a bit different. Okay. It's called compression garment therapy. Have you ever heard of it? Okay, so I'm going to go ahead and explain to you what that is before we get started. So basically, we're still trying to achieve the same goal, which is getting that excess fluid out of that right arm and transport it into that left arm where you have your more healthy nose that can get rid of that excess fluid, okay? Um, what this intervention is going to also allow for is reducing the size of that right arm, making it as normal as possible or similar to the left arm, okay? So does this sound like something that you're willing to do today? Hey, very good. I just got to ask you a couple of questions before we get started, okay? Making sure you are a good candidate for intervention. So first of all, do you have any history of cardiovascular disease?
No.
All right. What about peripheral artery disease?
No.
Any deep vein thrombosis, like a clot?
No.
Okay. What about any infections? Okay. You have any fractures in that right arm? Okay, very good. So based off the answers to my questions, I feel like you are a good candidate for this intervention. I just got to ask, check the integrity of your skin, and then I'm going to check sensation. And if all that goes well, we'll start the intervention. Okay? Just go, do I have permission to touch you?
Yes.
Just go ahead and look at the skin, back of the arm, front of it, the elbow region, and the forearm. Now look in between your fingers, okay? Alright, so the skin looks pretty well on that right arm, alright? Now I'm just going to check the sensation, alright? Can you feel that?
Yes.
Very good. So now I'm just going to check your right arm, okay? But I'm going to ask you to close your eyes and look away from it, alright? When you feel me touch you, just indicate by saying yes, okay? So go ahead and close your eyes for me.
Yes. 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 Yes.
Very good. So sensation seems to be intact as well. So I definitely think you're a good candidate for the therapy. All right, so we're going to jump right into it, okay? I'm going to make sure to keep your nail beds exposed, okay? If at all you feel numbness or tingling while I'm wrapping this arm up, make sure you go ahead and tell me, okay?
Okay.
Still doing okay? Can you go ahead and make a fist for me? Alright. How's that feel?
Good.
Go ahead and put this stocking on. Just protect the skin, okay? Go ahead and make a fist for me and punch into my stomach, please. Punch tight. Can you go ahead and bend your elbow for me? Gonna go ahead and add a little pad right here, alright? Now I'm going to start making my way back down the arm. No numbness or tingling, right?
Nope.
Okay, good. How's that feel?
It's good.
Okay. Gonna add another layer, alright? Place this between the thumb and index finger. Go ahead and make this one. And go ahead and bend your elbow for me. Make a figure 8. Alright. Continue with the arm. How's that feel?
Good.
Okay. Gonna go ahead and add another layer, alright? Start up a little higher. Okay. Go ahead and bend that elbow again. Figure 8. You doing okay?
Mm-hmm.
Alright, you got one more layer, okay?
Oh.
Bend that elbow for me. Start coming back down. No numbness or tingling, right?
Sure.
We're all set. How does that feel?
That's good.
Alright, I'm just going to see how you can move with it, alright? So go ahead and just bend the arm for me. Alright, can you go ahead and touch the top of your head? Okay, what about simulating like eating a fork or eating before you want? Okay, good. Alright, so that about does it for today. Before I let you go, I'm just going to educate you on a couple things about how to take care of it and the do's and the don'ts, okay? So first of all, when it comes to washing it, you want to make sure that you wash this garment every day, okay? When you wash it, you want to make sure that you use warm water. When it comes to drying, you don't want to put it in a drying machine or anything like that. You want to sit it out, lay it flat to air dry, okay? Um, as far as your skin is concerned, you want to definitely make sure that you keep the skin lubricated. Make sure you're using your lotions, okay? You don't want the skin to become dry and cracky. It can cause some cuts, which you don't want that at this particular time. You don't want it at all, okay? Um, I know it's the holiday season, so if you're going to be traveling by plane, you definitely want to make sure that you put this compression garment on, okay? Um, when you're at high altitudes, that can make things worse and bring back that swelling, which we don't want, all right? Um, when you're at work or out and about, you want to make sure that you protect that arm, okay? Make sure that you don't bump into anything or anything bumps into you, because again, that can just make things worse, and we don't want that, all right? Um, any questions you have for me before I let you go? All right, Ms. Anderson, so this is what we're going to be doing in the subsequent sessions, all right? If you have any questions for me, feel free to let me know, and I'm going to try to address them, all right?
Okay.
So I'll see you next time, okay?
All right.
Have a good day.
You too.